Have you ever woken up in the middle of the night because your hand felt numb, or maybe your thumb, index finger, and middle finger started tingling while using your phone? Many people think it is just poor blood circulation, but that is usually not the real reason. The real problem may be a tiny tunnel inside your wrist, and one important nerve passing through it. Today, you will discover why your fingers go numb, what carpal tunnel syndrome really is, and how to recognize its warning signs before it gets worse. Let's begin. Welcome to MediLearn Hub, where we make medicine simple. Whether you are a medical student, a physiotherapy student, a nursing student, a healthcare professional, or simply curious about the human body, you are in the right place. If you enjoy clear medical explanations with simple animations, please subscribe to our channel. Now, let's explore what happens inside your wrist. Your wrist contains a narrow passage called the carpal tunnel. Think of it like a small tunnel under a strong roof. The floor and walls are formed by the wrist bones. The roof is a thick band of tissue called the transverse carpal ligament. Inside this tunnel are 9 flexor tendons. These tendons help bend your fingers. Also inside the tunnel is one very important nerve, the median nerve. Normally, everything fits comfortably inside the tunnel, but when the space becomes smaller or the contents become swollen, pressure builds up and the median nerve becomes compressed. This is called carpal tunnel syndrome. The median nerve is responsible for feeling in part of your hand. It provides sensation to the thumb, the index finger, the middle finger, and part of the ring finger. It also controls some of the small muscles at the base of the thumb. These muscles help you grip, pinch, and hold objects. When the median nerve is compressed, it cannot send signals properly. That is why you begin to feel tingling, numbness, pain, or weakness in your hand. These symptoms often start gradually, but they usually become worse over time if the pressure continues. The earliest symptom is usually tingling. Many people feel pins and needles in the thumb, index finger, middle finger, and half of the ring finger. At first, it may happen only occasionally, especially while holding a phone, reading a book, driving, or typing on a keyboard. Nighttime symptoms are very common. People often wake up and shake their hand to make the tingling go away. This happens because the wrist is frequently bent during sleep. Bending the wrist increases pressure inside the carpal tunnel, and the median nerve becomes more irritated. This is one of the classic signs of carpal tunnel syndrome. If pressure on the nerve continues, the symptoms usually become more frequent. Tingling may turn into numbness. Pain may spread from the wrist into the forearm. Some people notice that objects slip from their hand. Buttons become difficult to fasten. Opening jars becomes harder, and writing may feel awkward. As the nerve becomes more compressed, the muscles at the base of the thumb can become weak. In severe cases, these muscles may shrink. This is called muscle wasting. That is why early treatment is important. So, what causes carpal tunnel syndrome? The most common cause is repetitive wrist activity. Typing for long hours, using a computer mouse, assembly line work, hairdressing, sewing, and many other jobs that require repeated wrist movements can contribute. Swelling inside the tunnel can also occur during pregnancy. Diabetes, hypothyroidism, rheumatoid arthritis, and obesity increase the risk as well. Sometimes there is no single obvious cause. Several small factors may work together over many years. Not every numb hand is caused by carpal tunnel syndrome. A pinched nerve in the neck can cause similar symptoms. Ulnar nerve compression usually affects the little finger. Poor circulation can cause coldness and color changes. Doctors look carefully at which fingers are affected. Symptoms involving the thumb, index finger, middle finger, and part of the ring finger strongly suggests median nerve compression. The little finger is usually spared. That pattern is an important clue. If your doctor suspects carpal tunnel syndrome, the first step is listening to your symptoms. They will ask which fingers feel numb, when the symptoms started, and whether they become worse at night. Next, they will examine your hand and wrist. One common test is called Tinel's sign. The doctor gently taps over the median nerve at the wrist. If this causes tingling in your fingers, it may suggest irritation of the median nerve. Another test is called Phelan's test. You bend your wrists forward and hold the position. If numbness or tingling appears within a minute, carpal tunnel syndrome becomes more likely. Sometimes doctors also perform nerve conduction studies. These tests measure how fast electrical signals travel through the median nerve. A slower signal may confirm compression inside the carpal tunnel. The good news is, many people improve without surgery if the symptoms are mild. A wrist splint worn at night can keep the wrist in a neutral position. This reduces pressure on the median nerve while you sleep. Taking regular breaks during repetitive work, improving your workstation, and avoiding prolonged wrist bending may also help. If symptoms continue, a doctor may recommend a corticosteroid injection to reduce swelling around the nerve. When symptoms become severe or muscle weakness develops, surgery may be recommended. The operation creates more space by releasing the transverse carpal ligament. This reduces pressure on the median nerve. You cannot prevent every case, but you can reduce your risk. Keep your wrists in a comfortable, neutral position when working. Take short breaks if you type or use tools for long periods. Stretch your fingers and wrists regularly. Avoid gripping objects too tightly for long periods. Maintain a healthy weight. And manage conditions such as diabetes if you have them. Small changes in your daily routine can help protect your median nerve. Let's quickly review what we learned today. Carpal tunnel syndrome happens when the median nerve is compressed inside the carpal tunnel. The most common symptoms are tingling, numbness, pain, and weakness in the thumb, index finger, middle finger, and part of the ring finger. Symptoms often become worse at night. Early diagnosis and treatment can prevent permanent nerve damage. If your symptoms continue, do not ignore them. Seek advice from a qualified healthcare professional. If you found this video helpful, please like this video, subscribe to MediLearn Hub, and share it with someone who might benefit. Thank you for watching. Stay curious, stay healthy, and I will see you in the next video.